Welcome all of you. Myself, Assistant Professor Varsha Tambe from KKWA College of Pharmacy, Nasi. Today, we are going to discuss topic hypertension. What is hypertension? Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. The systolic blood pressure will be more than or equal of 140 mm of Hg and diastolic blood pressure will be more than or equal of 90 mm of Hg. Types of hypertension. First type is prehypertension. Systolic blood pressure in prehypertension is in between 120 to 139 mm of Hg and diastolic blood pressure is 80 to 89 mm of Hg. Second type of hypertension is hypertension stage 1. In this, systolic blood pressure is 140 to 159 mm of Hg and diastolic blood pressure is 90 to 99 mm of Hg. Hypertension stage 2. In this stage, systolic blood pressure is more or equal to 160 mm of Hg and diastolic blood pressure is more or equal to 100 mm of Hg. Fourth type is pregnancy-induced hypertension. Because of increased production of hormones and enzymes during pregnancy, this type of hypertension occurs. Etiology. So, in primary hypertension, it is the elevation in blood pressure without an identified cause. Secondary hypertension, it is the elevation in BP with an exact cause. This type is account for 5 to 10% of total cases. The causes of secondary hypertension includes congenital narrowing of aorta, renal disease, endocrine disorders like Cushing's syndrome, neurological disorders like brain tumors and head injury, sleep apnea, medications like oral contraceptive pills, NSAID and cocaine. Last cause of secondary hypertension is cirrhosis of liver. Risk factors in hypertension. First factor is age. Chance of coronary artery disease after 50 years of age are increased. Then next risk factor is alcohol, smoking and diabetes mellitus. Excessive dietary intake of sodium, then gender, family history, obesity, sedentary lifestyle and stress. Pathophysiology of hypertension. The normal blood pressure is maintained by 4 mechanisms. First is sympathetic nervous system activities. Second is activities of vascular endothelium. Third is activities of renal system. And fourth is activities of endocrine system. Let's see one by one. First is sympathetic nervous system activities. When the blood pressure is decreasing, the activation of sympathetic nervous system will occur. The increased sympathetic nervous system activity increases the heart rate and cardiac contraction. The increased heart rate and cardiac contraction produce vasoconstriction in the peripheral arterioles and promotes the release of renin from kidney. The net effect of sympathetic nervous system activation is to increase the arterial blood pressure by increasing cardiac output and systemic vascular resistance. So, blood pressure is equal to cardiac output into systematic vascular resistance. Second is activities of vascular endothelium. The vascular endothelium is a single cell layer that lines the blood vessel. It will produce vasoactive substances and growth factors like nitric acid, endothelin, etc. These substances are potent vasoconstrictors and causes increases blood pressure level. Third is activities of renal system. So, as kidneys function is to regulate blood volume. So the juxtaglomerular cells of kidney secretes renin into the blood. Then renin converts the plasma protein angiotensinogen in angiotensin first, and then this angiotensin first will further converted into angiotensin second. So this angiotensin second activates two mechanisms that raises blood pressure. First is angiotensin second stimulates the adrenal cortex to secrete aldosterone, and second is rising blood pressure by increasing blood volume. Fourth is activities of endocrine system. When the angiotensin second is stimulated in the adrenal cortex, it will secrete aldosterone. The aldosterone will stimulate the kidneys to retain sodium and water. Thus, the blood pressure and cardiac output will get increased. So, what are the clinical features of hypertension? Sometimes the high blood pressure does not cause any symptoms, so that it is known as silent killer disease. In some patients, the symptoms will develop like severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, confusion epistaxis, chest pain, shortness of breath, irregular heartbeat, and papilledema. Next, there are various diagnostic features of hypertension. First is history collection of patient and physical examination of patient. Then medical history of diabetes mellitus, complete blood count, chest X-ray, and ECG. On the basis of these diagnostic features, one can identify whether the individual is suffering from hypertension or not. So there are various preventive measures for hypertension. First is eat a healthy diet. Choose healthy meal and snack options to help you avoid high blood pressure and its complications. Keep yourself at a healthy weight. Having overweight or obesity increases your risk for high blood pressure. Be physically active. Do not smoke. Limit how much alcohol you drink and get enough sleep. Management of hypertension. Mainly the management of hypertension is possible by two ways, which includes first lifestyle modification and second is pharmacological therapy. Let's see one by one. First is lifestyle modification. The lifestyle modification measures mainly includes weight reduction, DASH diet, that is dietary approaches to stop hypertension, dietary sodium reduction, reduce alcohol, exercise properly, and management of stress. Pharmacological therapy. Various groups of drugs are used for the treatment of hypertension. Collectively, these drugs are called as antihypertensive drugs, which includes diuretics. It helps the kidneys to inhibit the sodium reabsorption in the distal convoluted tubules, ascending limb, and loop of Henle. Example of diuretic are chlorothiazide and furosemide. Next drugs are beta blockers. These medications reduces the workload of the heart and blood vessels and causing the heart to beat slowly and with less force. Example atenolol and propranolol. Next drugs are alpha blockers. These medications causes the peripheral vasodilation of blood vessels. Example prazosin. Next are vasodilators. These medications acting directly on the muscles in the wall of arteries and preventing the muscles from tightening and arteries from narrowing. Example nitroglycerin, sodium nitroprusside. Next are ACE inhibitors. This group of medications will reduce the conversion of AI and of angiotensin first to angiotensin second and prevents vasoconstriction. Example captopril, ramipril. Calcium channel blockers. These medicines will block the movement of extracellular calcium into the cells and causing vasodilation and decreased heart rate. Example, amlodipine and verapamil. Alternative therapies which are helpful to regulate blood pressure includes acupuncture, relaxation techniques and diversional therapies. So what is nursing management for hypertension? Proper history collection should be done, which includes family history also. Dietary habits should be assessed. Identify the medical history such as diabetes, CAD, renal diseases. Instruct the patients to avoid smoking and alcoholism. Auscultate heart rate and palpate peripheral pulses. These are the nursing management. Next is identify the use of medications such as contraceptives, steroids, NSAIDs. Monitor vital signs frequently. Provide diet which is low in sodium and rich with fruits and vegetables. Monitor the blood cholesterol level frequently. That's it for hypertension. Thank you.